Hello, and welcome to another episode of Let's Chat About Aging in Your Community. This is a program that is sponsored by CHATS, Community and Home Assistance to Seniors. And while we're a regional organization, many of the topics that we discuss in our program do deal with national issues related to aging with dignity and in the community. Many studies have shown that people want to live in their own homes as long as possible and to stay in their own communities. And the kind of work that CHATS does enables them to do that. And that's why we bring different guests into the program to talk about ways in which that can be accomplished. Today's program is going to focus on something called NORCs. And NORCs are not something from outer space, for those of you who remember uh, the MORC from ORC program, but naturally occurring retirement communities. And these communities are developing into places where seniors can come and be active, engaged, have access to healthcare, social supports, a whole range of things. And personally, this is something that I'd like to see really expand across the country. So today's guest is going to talk to us about NORCs and the different kinds of programs, how they do support older adults in places where they live, and how we can work together to increase the presence of NORCs across the country. And particularly in our interest in York Region and South Simcoe. With me today is Dr. Howard Abrams. Dr. Abrams is the director of OpenLab and the medical lead for the NORC project at the NORC Innovation Centre. OpenLab is a design and innovation group that looks for creative solutions at the intersection of health and society. And that's how that connects with the OpenLab's NORC project. So just to start, Dr. Abrams, let's talk about what is a NORC.
So a NORC is really a description. It's a place where a concentration of older adults just happen to be living together. For our purposes, we've defined them as buildings where more than 30% of the residents are over the age of 65, and there's more than 50 residents altogether. But that's our working definition. There may be other definitions that other people use. I think the commonality is a concentration of older adults living in proximity so that we can use that concentration for community development and for more efficient delivery of services.
Okay, so we've got a building. We've got 30% or more of the residents or tenants in the building who are older adults. So what does a NORC program do? What does it look like within the building?
Sure. So let me just make a small aside, because we also talk about horizontal NORCs, which are not necessarily a single building. Could be several buildings in close proximity, or it could be a neighborhood. I think in the old days we used to call them villages, but now we have to make these artificial constructs. So in terms of what do NORC programs look like, I think from, our fundamental value is that they are resident driven. So it's really understanding what the express needs of the residents are. And they might be tenants in rental buildings, they could be owners in condos or co-ops, and they could be across the entire socio-demographic spectrum. So it starts out with understanding what people need and what people want. And then the foundation is mutual support. So it's often that you discover that there's incredible expertise and experience within these buildings amongst older adults. And if they were able to connect with each other and be aware of what's available, they could provide a lot of support for each other. And we talk about support for the little things, and not to denigrate them. They're critically important. A small thing like being unable to replace a light bulb in a high space could lead to a dark corner, which could lead to a trip and fall, with the whole cascade to very unfortunate outcomes. So that's kind of the foundation. Really resident directed and mutual support. And then on top of that, it's discovering what's available in the community, the surrounding community. Because when we talk about community, it's not just the community within a building, it's the whole community ecosystem. And what we've discovered is there's a huge range of community services available that people are either unaware of or are finding difficulty accessing. And so that's another level of community building. And then in our model, and we're fortunate to be associated with the University Health Network and their connected care group, we also can escalate meeting needs up to the clinical level. So our first go-to is always what's their current circle of care, or circle of trust, as I like to call it, helping them connect with their primary care providers and known specialists. If those folks need some help from us, or if that circle is not complete, we can help make those connections. So that's kind of, in a nutshell, what it might look like.
So is this a new phenomenon of NORCs? I mean, we're hearing more and more about it, and I just have to put in a plug for chats that we have now launched 3 NORC programs in 3 different buildings in York Region, and they've been very successful in the short period of time that we've established them. We hope to be able to expand across the 2 regions that we serve over time, but we're certainly hearing more about NORCs in addition to the work that we're doing. But is it new? Is it something that the OpenLab and NORC Innovation Centre just, came up with in the last couple of years?
Well, I'd love to take credit for it, but I don't think we can. I think it's having its moment. But back in the 70s, it was more formalized coming out of New York City, where groups of older adults were looking for increased support. And that kind of generated this term of NORC and the idea of actual municipal support for that type of organization. I think, to reflect on what Chat's doing, from our perspective, that is the most successful, that is the biggest measure of success. When it's not us doing it, it's people like yourselves who see the model, realize how powerful it is, and just go and do it themselves, with some support and tools that we can provide, but not at our initiation. So it's great. What Chat's doing is amazing.
Yeah. We often hear people say, and particularly in those vertical buildings that do have a higher proportion of older adults, that people don't even know their next door neighbor. They come in and go straight into their apartment and they leave. They don't necessarily socialize with their neighbors. So how do you get started with a NORC program if you've got a situation where, I don't know, is it that people are afraid to get to know others in the building, or just that they haven't had somebody else to pull them all together? Like, what are the foundational blocks to get a NORC program going?
So, it's interesting that you say that about, neighbors not really knowing each other. One of the things we hear from buildings that we're working with is, before, that was exactly what it was like. They go into the elevator and everybody's looking at the numbers or looking at the floor. And now people actually greet each other and ask what's going on with them, and probably know about their kids and their grandkids. And it feels more like community. So how do you get to that space? I think there's no one size fits all. What we see is there are for example, buildings that we've worked with, we would do some kind of, advertising campaign, whether it's putting up posters in the building, in the lobby, in the elevators, just saying, hey, we have this idea. If you're interested, let's have a meeting and see where it goes. Sometimes you have a very, and it always starts with a little thing like that. And what really helps it move along is really committed and enthusiastic residents who really want to make this happen. And that's kind of where it starts. And it could start with something really simple like tea and cookies or a soup lunch. Just a place where people gather with some kind of social activity. And eating is one of the best social activities. And then conversations start. And then it's about making acquaintances. And then it may even evolve into making friends. And then it becomes word of mouth. And then it becomes some kind of group that wants to really make this happen. Now, the buildings we work with are what we call our pilot sites, where we're experimenting with different levels of support to see what are the critical factors that really make these things work, what are necessary but not sufficient, and what are nice to haves, but kind of at the next level. So it's hard to say, well, this is how you do it. Step one is this, step two is this. But I think you can say step one is introducing the idea and inviting people to come for tea and cake or tea and cookies. And that's where it starts.
So it doesn't necessarily mean that you have to have an outside organization come in and run the whole thing. It could be as simple as you say, as getting somebody to be the catalyst, put up some posters, say, come down for coffee and tea, and then just get some conversation going about what kinds of activities would you like to see or what kinds of things would you like to do, and then start to enlist the tenants or the residents in actually taking on the program.
Yes, absolutely. So that's definitely one model. It could come from and what we see, because we have what are called our NORC talks, where once a month we invite people to come and hear about different aspects of, forming a NORC, running a NORC, those kinds of things. You might have one really committed, charismatic resident who hears about this and says, I want to do this. And they go to our do-it-yourself website and they look at our tools and they just start it themselves. It could be a group like Chats who is getting a lot of experience with this and realizing there are buildings in their communities that could benefit from this. And so Chats might go to a building and talk to either people they already know, people who are already receiving services, or putting up some attractive posters in a lobby and saying, hey, come to a meeting. We've got an idea you might like. So again, it's like there are principles that are important, like self-direction, mutual support, etc. But how they're implemented is really dependent on local circumstances and local resources.
So we've got these programs started and feedback has been very, very positive. What kinds of evidence or research is being done to demonstrate what the health benefit of these programs are?
Yeah, so we have two levels of research programs going. We're not yet ready to publish results, but they're all showing positive trends. So we're partnered with the Women's Age Lab at Women's College Hospital, who are doing a very large study on both the implementation process and the benefits of NORCs. And then within our own group, we're doing some focus studies on, we have it divided, and I don't know if I'll get it all right. We look at healthy communities, healthy buildings, healthy individuals. There's another health group, but it's basically trying to understand the ecosystem from the individual to the building to the community level. And we have specific measures for that. OASIS, which I think you're familiar with, which interestingly, we were involved with the original OASIS Centre in Kingston and gave them some support. And they've gone on to do some great stuff and publish some really good research and expand their network. So there is good research out there supporting the health benefits of community mutual support, reduced healthcare utilization, reduced falls. And you can do very specific targeted programs like a falls prevention program, but there does seem to be kind of larger benefits that just accrue from a sense of community and an actual community that functions supportively.
There's a program that is sort of developing and starting to expand out of the Burlington area called the PACE.
Right.
The PACE program for community hubs. Can you describe that a little bit and how that differs from, I don't want to say a more basic NORC program, but you know where I'm getting at.
Yeah, so I think I'm familiar with PACE. I speak on their behalf with caution because I'm not intimately involved. But from my understanding, it's a great model where you might have a more dispersed population that doesn't have the concentration of older adults to benefit. And so you can have a hospital or healthcare institution that's kind of the hub. And it may actually be a long-term care institution, or it could be a retirement residence. It's not necessarily a hospital hub, although the advantage of the hospital hub is that they can tie you more to clinical services if needed. The disadvantage is that there's always a risk of applying more of a medical model. And then they can supply services like PSWs, home care, etc., ally with Ontario Hospital at Home to provide services. So that's another model. I think, and I, at the risk of not speaking fairly for them, I think the NORC model is great for areas where there's a concentration of older adults, for example, in buildings, vertical buildings. And the PACE model is great for addressing more dispersed suburban and rural areas where it's really a one-to-one service rather than a one-to-many service. So the advantage of NORCs, it's a one-to-many, and the advantage of PACE is that it can reach out one-to-one.
Now, you did talk at the beginning about bringing in and providing access to family doctors and other more clinical kinds of supports and activities through NORCs. How would we go about doing that? Moving, if I'm in a building, we've established a NORC program, but we want to now take it to the next step. How would we do that?
So, again, it's not one size fits all. You need a partner. So the NORC, the residents can mutually organize up to a point. They can engage with community services up to a point. And then when you get into the more formal healthcare environment, you do need a partner. So, we have the fortune of being able to partner with UHN's Connected Care. So we can directly connect to hospital services if needed. We tried not to. We tried to maintain that circle of trust, as I mentioned, support that circle of trust if needed. But if absolutely essential, we can connect to hospital services. One of the other models, which we're experimenting with, and I think Chad's involved in this, is our accelerator model, where we're seeing if we can partner with the OHTs and acquaint them with the NORC idea, show them the NORCs that are in their area, and then model some kind of support that takes advantage of that concentration of older adults and the ability to provide holistic care, both at the primary care level and then whatever there is at secondary and tertiary levels. I think, and you can speak to this more accurately than I can, I think CHADS is doing this, partnering with the OHTs. I think the critical thing is adapting the principles to the resources in your area. And one of the principles is the respect for the residents, really understanding their needs and working with them to have those needs met, rather than saying, here's what we're willing to offer you. That's unfortunately more of the medical model. The model should be, what do you need? What can we do for you? And sometimes we can't do what people would like, and we have to be transparent about that. Yeah. So partnering with OHCs, I think to me, that's a great solution. It might be partnering with directly with the OHC. It might be partnering with a community NGO like Chats, who can then facilitate that partnership and kind of broker it, help develop it. The one thing I really like about Chats is the extent of the services that are provided within Chats and its volunteer core. Because, again, volunteers are a way underused resource for older adults, or for any part of the community in need. We found that out during COVID, where we were able to recruit over 1,000 volunteers in a couple of weeks to help provide essential meals to isolated adults in the NORCs during the lockdowns. So again, it kind of flags that when you're aware of a NORC in your area and something like an urgency or emergency arises, you already have that relationship and that connection. We were able to bring COVID vaccines into those buildings. We could show where the most vulnerable populations were compared to where the pop-up vaccine clinics were, and show where unserviced areas were and where people would have difficulty accessing, even local vaccines, and we could bring vaccine teams in. So this, I know you haven't asked me this question, but this is another one of my pet things, is about the name naturally occurring retirement communities. So the advantage of that is that it's a well-known term. It's out there in the community, in the literature, people know what it is. And it does focus on older adults who are the vulnerable, part of the most vulnerable population. Well, some older adults have said to me, we don't want to be identified as living in a retirement community. We're not all retired. And there's lots of other young people and families in our buildings, and they don't want to be identified with a retirement community. So, I've floated this idea of changing it to naturally occurring resilient communities, because I think COVID showed, and, changes in our climate are going to impact us more and more with urgencies that need responding to. And we need to build resilient communities. But it does take the focus off older adults. So that change of term has been resisted. And I'm just putting it out there. I think at some time people will see that that's really what we're building. We're building resilient communities.
Now, another very important partner in this process that we haven't talked about is the landlord or the property manager. If we're talking again about focusing more on the vertical buildings as opposed to horizontal NORCs, how do we engage with them? And more importantly, for those that there's a lot of development going on in York Region, how do we engage with the developers and property managers to see that this is actually a important benefit that can be provided to their tenants and residents?
Yeah, so I think that's a really important connection that you brought up. We engage directly with them. So we go to them and say, hey, there seems to be some interest in your building around this. We'd really like to explain this to you. And we want them to try to understand what the purpose of it is. Sometimes there's some initial resistance. And then once it starts going, I think they love it, because you now have a committed group of residents who are not only looking out for the the people in the community. They're looking out for the building in the community. Older adults are great tenants. They tend to have reliable pension income or government income, although many of them really struggle to meet the rents.
Mm-hmm.
They don't write graffiti in the elevators. They don't mark up the walls. They don't have wild parties. So there are some benefits. I think the initial resistance seems to be overcome very easily. Sometimes if it's a condo or a co-op, the boards tend to be very leery of what they see as a parallel power structure. And we have to explain again what we're doing, what the intention is, how we can work with them the best. And so it's really all about forming those relationships and developing trust, because ultimately it's about trust.
Mm-hmm. And not only trust amongst the residents and the property management, but also with the organizations that are potentially coming in and providing services or access to services.
Yeah. So, this is sort of next steps is really trying to promote this relationship-based caring. And rather than transactional caring, where, we are going to provide this service to you on a commercial basis, it's time limited, it's a pay for service, which might be through a community agency that the government pays or through a personal private agency. It's more about building that relationship with the carers. And I think if you have, and this gets into a larger issue of reorganizing the way home care is delivered, but if you have a fairly consistent group of home care providers, they will build a relationship with the people that they're providing care for. And rather than it's someone who comes one day and then someone who comes the next day who doesn't understand the specific and particular needs of a resident, which they have to explain all over again, you actually build up a real relationship. And we know that the sense of networked relationships is health providing just in itself. So that sense of isolation tends to diminish. And we know the sense of isolation is a very negative factor for health.
Mm-hmm. Yeah. So we've got a program going. Perhaps we bring somebody in like a chats to get things started, organized. Ultimately, we really want to have the ownership of the activities, whatever the needs that have been determined, delivered. But I guess part of the objective is to try and ensure that ultimately it's the residents themselves who then take control, if you will, of the programming. How do you deal with, or how do you help to prevent, that typical thing where one or two people become the leaders, do all the work, and at some point they just say, "Okay, I've had enough." Like somebody else has to pitch in and help because I've done my bit.
Right. So we have a program called NORC Ambassadors, and it helps willing older adults become leaders in the community, and to form a NORC committee, which helps manage the activities that require organization within the building. We also promote a succession planning so that board keeps rotating, trying to make it as inclusive as possible because people are people and you never know what kind of people are going to step up. And sometimes they're the right people and sometimes they're not the best people to promote community. And these are the realities,
Yeah.
yeah. So we have some training around conflict management and organizing, community organization. In our own buildings, we can provide one-to-one coaching. We can help negotiate around individual members who may not be providing as positive input as we'd like or as the community would like. I think it'd be interesting for someone like Chats, who has that whole relationship-based caring approach, to look at how they might, or you might, help promote that within buildings that the OHTs might be supporting. Because I think that is a key piece. I mean, ultimately, it's about relationships.
Mm-hmm.
And we also accept that not every building will be successful. You know, so far we've had great success, but we've been providing a lot of input. But we have to understand that people are people, and you do your best, and then you see what happens.
So several times you've talked about we can provide this support, or we have this tool, or so is the NORC Innovation Centre and the NORC project something that, you know, if a group of people in a building at Yonge and Davis decide to form their own program, that they could just give you a call and say, you know, we need some help with conflict resolution, or we're kind of stumbling with this. How does that work? How does that relationship work?
Yeah. So there's a couple of levels. Yeah, they can always contact us, and you know, we can try to help. Our own resources and people power is limited, so you know, right now we're not looking to expand explicitly in other buildings, but we are looking to support the expansion in other areas. We also have our NORC talks, so every month a topic specific to NORCs is discussed, and people can come in person to our Bathurst and College office, or they can come virtually. And then we have our website with all our do-it-yourself tools and a community chat where people can say, hey, we're having trouble with this. Has anybody else faced this problem? And get some, you know, crowdsourcing wisdom on how to move forward.
Can you just quickly give us the website address?
I'd have to look it up myself.
Oh,
If you go to, I think if you Google NORC Ambassador or NORC Ambassadors, that will,
NORC
right,
ambassadors.
Ambassadors, it should come up. Yeah. The other website is NORC Innovation Centre, and that will tell you more about the explicitly the program that we're doing. But the NORC Ambassador site is the one that has the do-it-yourself tools.
Wow, that's a lot of information and a lot of progress on an area that is so crucial, particularly, you know, if we're truly going to support this aging population and help people to stay active in their communities, avoid that social isolation that can, as you indicated, it can lead to very serious chronic diseases and conditions, and you know, just make sure that we're building communities and safe communities for people. We're at our time. This has been a great conversation. I really enjoyed it. But just one last question for you. What is your vision for the spread and scale of NORCs?
I would, you know, as I said before, to me, real success is where a group of older adults spontaneously say, hey, let's figure out how to support each other. And then they take the next step and start some programs that bring them together, and then take the next step and say, boy, there's a lot of community agencies out here. Let's reach out to them, find one that's really compatible, and get them to help us to the wider network. I think, and maybe they use our website, and maybe they give us a call, but real success is, you know, it's like a psychiatrist says it's success when you turn around and say, oh, I could have done that without them. So that would be our success.
Thank you so much, Dr. Abrams, for being on our program today. We really appreciate it. Wish you the best of success. We're right on that train with you, and hoping that we can encourage the development of more NORCs throughout York Region and South Simcoe. Appreciate the support that you have given us so far, and look forward to working well together into the future.
Great.
And thanks to all of you for once again listening in or watching on YouTube our Let's Chat About Aging in Your Community, brought to you by CHATS, Community and Home Assistance to Seniors. Hope you've enjoyed this particular program, and encourage you to listen in on the many other programs that we've had in the past and coming in the future. Thanks so much.